I'm with AWC Home Care. Today I'm very happy to be with you again as I'm continuing in my journey of educating people about seniors. But educating people about health in general, why not? So today we're going to talk about a very interesting topic. Again, I'm with AWC Home Care. AWC Home Care is the home care company that does its best to keep senior in their home. We will be talking about depression. So depression is a condition that is very, very common in our seniors. Again, our job, if you notice throughout our page, throughout everything we've been doing through the social media and everywhere we are, our job has been to bring awareness about issues that our seniors have. So we'll talk about depression. We'll look at how we as healthcare professionals, how we diagnose depression, what are the symptoms we look at to determine that somebody has depression, and what are the steps we take, and the common signs that you should be looking at to say that somebody is probably depressed. Well, what is depression? Well, depression is really, and one word they define it as a sense of hopelessness. We have, this is again very common in the seniors. They have, for many reasons, they get very depressed. So as healthcare professionals, what we do, we have to do screening. We do very frequent screening on anybody who comes to our office to make sure if they are depressed that we address the issue they have. And the one thing that we use to check somebody to see whether they are depressed or not, we use something that called SIGECAPS. So the SIGECAPS is an acronym that we use as healthcare professionals to determine if somebody is depressed and if they are depressed, how depressed they are. So SIGECAPS, we can go through them a little bit. So the S stands for sleep. Anybody who is depressed, usually they have sleeping issues. Either they're sleeping too much, or in some situations, or most of the situations, they actually lack of sleep. They don't sleep at night. They think all throughout the night. They will say, hey, I only got a couple of hours of sleep. So this is what S stands for from SIGECAPS. Then you have I. I stands for interest. So those people with depression, usually they have lack of interest and things they used to like to do in the past. So somebody who used to like to go to the movie, for instance, all of a sudden they start decreasing the interest of going into the movie. So this is what the I stands for. So they lack interest in previous activities that they used to enjoy. And again, this is not just for the seniors, but we're talking for everybody in general. And so this is the S and the I. So the G, the G in SIGECAPS is also a very, important letter in the acronym. It stands for guilt. So people feel guilty. They feel guilty. They feel like, why am I here? So and when you look at the seniors, the elderly, so they feel guilty because they have so many of their friends passed away. They have so many of their family members, siblings, or grandparents, parents, they all passed away. So they feel guilty. They go through so much that they're still here, but they feel like, okay, why all my friends are gone and I'm still here? So they kind of feel that sense of guilt, So this is S-I-G. So we just talk about the G. Now the E is energy. When you depress, somebody who is depressed, usually they have a very bad lack of energy. So they are very low in energy. So sometimes they stay in bed. That's why a lot of the time people associate depression with somebody who's sitting in their couch. They don't go anywhere. They just keep eating. It's because of that lack of energy. Okay, so this is the E in SIGECAPS. And the C stands for concentration. The people with depression, it's very hard for them to concentrate. Sometimes saying if they're in school, they're trying to read something, they may read it now and the next minute they forget what it is. They may forget where they put things. They may forget where they put their keys. All those things because they are not able to concentrate. If they go to a classroom, they may have a lack of concentration. They can't concentrate anything. So the C concentration, that's what it means in the SIGECAPS. Now the A stands for appetite. Many people with depression, they have lack of appetite. They don't eat well. They just feel, sometimes they just don't feel any joy in eating. They feel no joy in eating, so therefore they sit down not eating. This is why it is very important for us to monitor our patient weight, especially people with psych issues. We always monitor their weight on a regular basis, because when you are depressed, a lot of the time people don't like to eat. They just lack the full interest in eating. And then you have the P stands for psychomotor dysfunction. People with depression, especially older people, sometimes they may be shaking, they may be very nervous, they may be happy now, the next minute they are not. They are very agitated, they got irritated very easily. So we have to know how to manage those people. And then the S is the last letter in SIGECAPS, stands for suicidal. So a lot of the people with depression, they may be suicidal. And our job is to make sure that when we screen those people, and again, it could be a family member or whoever it is, when you screen them, you want to make sure that you screen them to make sure if they are suicidal, that they tell you. So you want to ask them, are you thinking about hurting yourself? And you must not be afraid of asking somebody that question if you think they're at risk for suicide. So you want to ask them, are you thinking about hurting yourself? And then if they say yes, you're going to say, do you have a plan? How are you going to do it? And the minute somebody says they want to hurt themselves, you need to help them to get some help. You need to convince them some reasons why they should not hurt themselves. That's extremely important. So usually we use that acronym of SIGECAPS to determine how depressed you are. So usually if those few things we talk about, like the sleep, the lack of energy, lack of interest, the problem with appetite or suicidal, if we have at least 5 of those positive, then that means you have major depression. However, we have less than 5, like between 2 and 3 of those checks, then we're gonna say you have minor depression. So how do we address those issues? How do we address somebody with depression? Well, depression, usually what it is a chemical imbalance in your brain. Okay, you have some neurotransmitters in your brain, call them serotonin, dopamine, and norepinephrine. So some of the neurotransmitters are happy transmitters. They are the transmitters that help you to feel happy. And some of them are the transmitters that make you worry. Now, our goal is not to have too much of one or too little of one, because again, the one that makes you worry, it's also the one that helps you to get up in the morning and go to work. So you want to be able to have that little worry in you that, okay, I have to get to work on time. I have to get up and go to work. Now, the other ones are the ones you so happy, or you have so, saying if you have so much of dopamine in your body, or so much of serotonin, then it can make you feel so happy that you don't care. You become careless. So this is why you have to have that balance. So when I have patients come to the clinic to see me, and again, I work at a mental health facility as well. So when I have patients come and see me, I have to look at them and try to help them balance what's going on in there. Help them with the chemical imbalance that they have in their brain. So the way you do that, unfortunately, it is different from like when I work in the hospital, for instance, where I can draw your blood and check your numbers and I see where you are and treat you. With psych issues, it's very hard because you have to go based on what the person tells you. So they have to tell me how they feel. You have to go based on feeling. You have to go based on what they tell you. So they have to tell me whether they can sleep or not. I can't tell. I can't draw blood to determine how much of chemical imbalance they have. So it is very important that people with psychiatric issues, it is very important for us to focus and listen to them. That's extremely important because that's the only way we get our information as far as should we increase their medication or change it. So usually when you come in, I treat you, you're gonna come back. I'll have you come back, and if the situation is hard, it's you're very unstable, I may ask you to come in 2 weeks, but usually I have you come back in 4 weeks, okay? In 4 weeks, when you come back, you're gonna tell me how you're feeling. And I usually start you with the lowest medication. Now, it's pretty much a trial of medication. You can't be sure which one because you don't know which of the chemicals is off. So if you're depressed, I'm assuming that you have one of those chemicals that is not balanced in your brain, whether it's your serotonin, dopamine, or norepinephrine. I don't know which one. So my job is to give you some medication, have you go home, you take that medicine. When you come back, you will tell me how you're feeling, because that's the only way I can treat you. When you come back, you say, hey, this is how I feel now, and then I either increase your medication or decrease it. In a lot of situations, you start them with the lowest dose. So you give them, we commonly use medication like Paxil or Zoloft for those people with depression, because those medications, we call them SSRIs, they don't have as many side effects as some of the other classes of medication, and they are very commonly used. So we usually start this medication and we start at the very low dose, and then you come back and tell me how you're feeling. And when you come back, we evaluate you, we change the medication and see how it's working. Okay, we adjust it, decrease or increase it, or whatever we have to do. So now, as you all know, my focus is really seniors. And again, when we talk about SIGECAPS, we look at one of them that is very common in seniors, the G, which stands for guilt. Many of our seniors have that guilt, that sense of guilt. They feel very guilty for many things. They feel guilty, maybe they should have helped this friend, or they feel guilty because they are alive and so many of their friends are gone. Okay, so we want to help promote the idea of screening them for depression. Now, one of the other things that we need to also know, depression is kind of a triad. Whenever you talk about depression, you see sleep and you see anxiety. So everybody that comes to the clinic that I treat for depression, I end up treating them for anxiety and sleeping disorders as well. Because usually sleep disorder and anxiety, they come hand in hand with depression. The other thing is, most people with depression, they end up having some symptoms of bipolar. Because what happened is, when those people, when they feel depressed, the depression caused them to have that other mood that you would look at them, you would be like, well, you are very friendly. What happened to you? You just changed. But what happened is, because of the depression, caused them to have those bipolar those bipolar symptoms as well, which in one of our next video we'll be talking about bipolar. So it is very important that we look at our seniors, ask them questions, ask them, how is your sleep? Do you sleep well? Or do you still continue to do the things that you used to like to do? Like if you used to go to the supermarket, do you like to watch those shows? Do you still like those things? Because if you are familiar with those questions, you can actually ask those questions. If you are not a medical provider, I'm not saying you should go and diagnose somebody and say, hey, you must have depression. However, at least you can bring that to the doctor, whoever is managing them, the primary care doctor. Then at least they could refer it to a psychiatric place, or at least most primary care, they can prescribe some low dose of antidepressant, at least to see how you're doing with it. So this is extremely important. Now, some of the medication for depression can cause symptoms like sexual dysfunction. I know many of the men would come to the clinic and they would just say, hey, I just don't want to take this because of how it makes me feel. Well, what I want you to do is talk to your doctor, because there are other options of medications for your depression that you can take that will help you, that you don't have those symptoms of those sexual symptoms, because we don't want to hurt you. When we treat you, we want to make sure that we give you medication to help you, but we also doesn't want to create other issues in your life. So usually to treat depression, you have to look at the person anxiety level, because I have never seen one person that comes to me that is having depression that do not also have anxiety. So I have to put them on some medication, some Buspar, some Xanax. I have to put them on something to help with the anxiety on top of the depression. Now, when you're depressed at nighttime, you don't sleep because you thinking, you feel so sad and everything. So all those people, usually when you come in, I'm definitely going to ask you some questions about, do you sleep at night? How many hours do you sleep? Do you feel anxious? Tell me about your anxiety level. And then what I'll do, usually I'll end up put them on some like Trazodone, some Xanax or Buspar, as I said. So put them on some medication for anxiety and some medication for the depression, as well as for sleeping issues. So if you're watching this video, really what I want you to get out of it is we have a very, very big problem within our senior community as far as depression. Depression is a very, very, very big issue. A lot of time it is not reported. A lot of time people look at it as being, I don't want to show people that I'm feeling that way. People try to cover it up, especially when it comes to men. Sometimes it's, you try to be strong, I'm fine. But this condition is very common in the seniors. It's very, very common. A lot of those people, they sit at home because imagine that you were in the community, you were working in the community, you were doing everything. Now you're retired. Now you are not able to do much for yourself. Now it's very hard for you to get up to cook your food. Nobody's visiting with you, especially in a society where a lot of the time we neglect the seniors, which is one of the main reasons I started this campaign in the first place. Because I think in a community, we should still put the seniors where, and they should have a place in our society. I'm not saying we rejected them totally, but I think we could have treated them a little bit better. Not because somebody is older or is old that we should look at them differently. Those people, they need help. We should just help them. We should be nice to them. We should always be grateful to those people, because those people, again, as I said in many of my other videos, those people, they are the backbone of our community. They are the people who were there for us when we were younger. I always say, if we are able to work at a place, if you're able to get a job, you're able to drive those roads, those highways, it's because somebody who is older now started it. It wasn't started on its own. Somebody started it. Today, if I'm doing what I'm doing, someday I'll be older, somebody will replace me. So I do want to be treated well when I get older. So our job should be to treat the elderly well right now. This is our job. We should treat them well. We should do the very, very best to give them the best quality of life, which is what we do. So again, as you guys know, I'm part of a home care company. Again, we do a lot of education, not just in social media, but we do education at all senior assisted living. We do it in senior communities. We do it in nursing homes. So if you're watching this video and you know of any place who needs some type of education, we do a lot of education. If you go to our YouTube channel, we talk about a lot of safety issues in seniors, like aspiration, like fall precaution, medication management and everything. We talk about all those issues. So if you know a group of seniors in an area that needs some type of training or some type of education, you know a group of family member who may need a get together where we talk about some of those issues, please send them our way. Our number is 678-696-9905, or you can visit our website at www.awchomecare.com. We'll be more than happy to help them. Also, one of the things we also do is, if you're watching my video and you know of a senior who is at home, who may be at risk for fall, or who may not be having a good quality life, who may need a kind of an assessment, a provider to come by and check on them, I will be more than happy to do that. I do that a lot. I go around and it's free of charge. I would go there and check on them, make sure they are fine. If they need help, what I do is, if family members around, I will help them. I will kind of instruct them as far as give them some techniques to take care of that senior person at home and make sure they stay at home safely. Because one of the things that I'm very big at is we need to take care of those people at home, and we need to make sure they stay safe at home. So it's not just for them to stay at home, but we want them to stay safe at home. So that's extremely important to me, and this is why I'm doing what I'm doing today. This is why I'm providing all those educational videos. I want to bring the awareness that seniors should stay at home. Again, if you just connected to us today, we were talking about depression, which is a very common issue in our seniors. We're talking about depression. We define what depression is, which is a chemical imbalance in your brain that is caused by some imbalance in some of the neurotransmitters, such as dopamine, norepinephrine, and serotonin. So we also talk about the acronym that we use as healthcare professional to treat depression, which is SIGECAP. SIGECAP, we say the S stands for sleep. Those are some of the things that are usually associated with depression. S stands for sleep. I is lack of interest, means they are not interested in things they used to do or they used to like to do in the past. The G is guilt. They have a sense of guilt. They feel guilty, especially, as we said, it's very common in our seniors for them to feel very guilty because they feel like they should have accomplished this, but they didn't. We say the C is concentration. Most people with depression, we say they have concentration issues. They are not able to think. They have lack of memory, so they can't, like if they read a book, it's very easy. They'll be like, what did I just read? So maybe I need to write it down. This is what happens to somebody who is stressed, saying if you are in college and you're very stressed out. So I'm pretty sure many people could relate with that, where you feel very stressed out and you wrote something or you read something, but you just read it, but you couldn't remember what it was. And then the A is appetite. They have lack of appetite. They don't want to eat. So that's why we have to continue to monitor their weight on a regular basis. So we need to monitor the weight. And then the P is psychomotor instability. Many of the seniors, especially, when they are depressed, they are very agitated. They are very irritable. Easily, you tell them very simple thing, they got mad or they blow off. So again, it's not their fault, but it's because of the depression, okay? And the S, of course, stands for suicidal. So if somebody is having thought of hurting themselves, that's that's very important. We need to address that. So again, we did talk about some of the medications, how we manage this, how I manage it myself at the clinic. But again, what we can do as a community is to look for people with those signs. Look for our seniors who may have those signs. Instead of saying, oh man, grandma is, off the chain. Instead of saying this, let's say, hey, grandma, maybe we should go to the doctor and have them check you out and see maybe you're depressed. Or maybe let's just go ahead and talk to them. And when we go there, talk to them, maybe you can call the doctor on the side and say, my grandma is acting this way. What do you think? I heard about depression. You think it may be depression? Because again, guys, believe me, this is very, very common in our community. This is extremely common. And again, if you're watching this video, I want to say thank you to you. Thank you very much to you, because watching my video is helping me in this journey. Watching my video is being part of what I'm trying to do, which I think that is what I'm trying to do is a very, very, very important initiative, is to try to bring awareness about older people, about the seniors, about the people who need help, the people who need somebody to come and help them, the people who need to be treated with dignity, the people who need to stay at home and who deserve to stay at home, where they belong, and as I always say, where they feel love. So again, if you know anybody who needs help, our number is 678-425-4030. You can visit our website at www.awchomecare.com. psychomotorofdysfunction.com. Thank you for watching. Continue to follow us. Please don't forget to follow us on Twitter, Instagram, Snapchat, obviously Facebook, and follow our YouTube channel. Share it as many times as you can. Please help me spread this message. If you have any advice for me, please. And thank you for the people who've been calling me, who've been encouraging me, been sending me private messages. I really appreciate you all. Please continue to help us. Again, my name is Jean Bastilla, and I'm with AWC Home Care. Thank you. You all have a nice evening.